Welcome to the first session of the Asian Stigma Discrimination Forum 2022. My name is Nittaya Phanupak and I'm the Executive Director of the Institute of HIV Research and Innovation, or IHRI in Bangkok. It is truly my great pleasure and my great honor to start the forum by giving this brief set the stage talk to all of you. I will briefly remind you of the HIV status neutral approach and to point out how U equals U and PrEP and STIs and HCV are its key components. And then I will also review a little bit on how stigma has impacted the uptake and the use of sexual health services. Then I will also talk a little bit about how stigma and discrimination violates medical ethics, perpetuates health inequity, and also violates sexual rights. And then I will end by give you some tangible examples of the do's and don'ts in healthcare settings. Now let's start with the HIV status neutral approach. And through this lens, we can see that once individuals coming in for HIV testing, they will be given equal importance regardless of their HIV status. Those tested HIV positive will then be offered immediate ART in order to make sure that they will achieve the final goal of having zero risk of sexual transmission of HIV with the undetectable viral load. Which is also known as U equals U or undetectable equals untransmittable as soon as possible. And for those who tested HIV negative, they will also be offered PrEP and PEP and other prevention modalities immediately in order to bring them to the final goal of having almost zero risk of HIV acquisition. And beyond U equals U and PrEP, the sexually transmitted infections services, including HCV, are also key components and will need regular asymptomatic screening of these STIs as part of the status neutral approach, both for HIV positive and both for HIV negative individuals. However, the use of U equals U, the use of PrEP, the use of STI test and treat services are still very limited. And this is due to the strong and pervasive stigma. And stigma is a personal characteristic that is socially discrediting. And for HIV stigma as defined by UNAIDS is a process of devaluation of people either living with HIV or associated with HIV. And we know that it's not stigma towards HIV itself, but it's stigma towards characteristics which are found commonly among various key affected populations, such as being in sexual and gender minorities or engaging in sex work, engaging in substance use. And therefore, for sexual health services, they are also stigmatized as these services are linked to HIV, are linked to sex, are linked to sexual pleasure, which are all those socially discrediting behaviors, especially in our region. And for HCV in particular, it's not only obviously related to condomless sex, but it is also related to other socially unacceptable behaviors such as injecting substance use. So for PrEP is stigmatized because it is related to sex. It is related to condomless sex, as many people would assume that PrEP users all want to have condomless sex. So, and then condomless sex or sexual pleasure is even further devalued in many of our societies. For U equals U equals U is also stigmatized because no matter you say it out loud or not, U equals U means condom is not required to prevent HIV transmission. And now it goes again with condomless sex and sexual pleasure, which are very much stigmatized in our societies. And beyond those stigma related to sex and sexual pleasure. U equals U stigma is also related to stigma towards PLHIV stereotype, the stereotype of PLHIV being a responsible person in terms of sex and in terms of life. So we can see that it is very, very strong. And therefore, for U equals U, we can see that some healthcare providers deliver information, U equals U information, in an ambiguous or distorted way, intend not to use the word zero risk of sexual transmission. And among 246 healthcare providers who are providing care for PLHIV in Thailand, in a survey conducted earlier this year, although 90% of these healthcare providers are aware of U equals U, 85 to 90% said that they understood, they believed, and they felt confident in communicating U equals U. But we can see here that 6% reported no communication about U equals U to their clients or their patients whatsoever. And 40% reported communicating U equals U only when prompted. And only just above 1/3 communicated U equals U during every visit. And this may be due to general discomfort of discussing sex with their clients, their patients, or anticipated changes in personal responsibilities, something like people will go back to having multiple sex partners or to have condomless sex. What these healthcare providers might forget or didn't realize is that by allowing your judgmental attitude to influence your clinical practice, that violates medical ethics. And among these medical ethic principles of autonomy, beneficence, non-maleficence, and justice, autonomy may be one of the medical ethic principles most affected by stigma and discrimination, because by withholding or distorting information around U equals U or PrEP, you are violating the right of an individual to be fully informed, and you may not respect the decision, may not respect the individual that they have capacity to make their own informed decision, and you may violate their free will to make decision, to do or not to do something, to change their mind independently from the will of others. And many healthcare providers may do that because they anticipate changes in sexual behavior among their clients. Do that mean withholding or distorting information about U equals U and PrEP? And they may do this because they feel that they are following the beneficence or non-maleficence medical ethic principle by not wanting their clients to be in a situation that they will be at risk for STIs or unintended pregnancy. However, with the information of U equals U and PrEP, people might or might not change their sexual behavior. And even if they change their sexual behavior, these changes do not confer an increased risk in HIV transmission. But discussing U equals U and PrEP as part of sexual health in a sex-positive setting can actually facilitate condom counseling as an option to prevent unintended pregnancy and STIs, but unnecessary for preventing sexual transmission of HIV. It can also encourage access to regular STI and HCV testing and treatment regardless of symptoms, which will help to curb down the epidemic of these STIs and HCV. On the other hand, by distorting or withholding or selectively communicating U equals U and PrEP, they violate medical ethics, as every client has the right to know about U equals U and PrEP. They also perpetuate health inequities because clients must not be selectively communicated due to any biases towards gender, sex, or race. And they also violate sexual rights because individuals, regardless of HIV status, have rights to fulfill and express their sexuality and enjoy sexual health. So now I'm going to give you a few tangible examples of the do's and don'ts in order to help us to establish a true stigma-free and discrimination-free healthcare settings. And the first one is to Make a clear and direct communication, not distorted by providers' judgmental attitude. Don't use moral judgment to moderate language, moderate U equals U language into something like close to zero risk or greatly reduced risk or minimal risk, but do unequivocally endorse U equals U message. Use a crystal clear language that U equals U means zero risk of sexual transmission of HIV to other people. And the second example is to recognize sexual pleasure as fundamental to sexual health and human rights. Don't stereotype groups of clients, especially PLHIV, as having sexual irresponsibility. And don't selectively withhold U equals U or PrEP information from sexual minority or those who are gender non-conforming individuals. But do discuss U equals U and PrEP in a sex-positive setting to facilitate condom discussion as an option to prevent unwanted pregnancy and STIs, but unnecessary for preventing sexual transmission of HIV. And for example, in this case, if this female client comes in and asks whether she can stop using condom with her partner with U equals U, the healthcare providers can simply respond by saying that, well, the decision is actually up to you and your partner once both of you are well informed. And the last example is to offer all HIV prevention options in a non-judgmental way. Don't use own moral beliefs to judge the client, and stop preaching or teaching with the clients with good intentions, but without understanding the client's context. But do offer comprehensive choices to the client to prevent HIV and other STIs. Trust in the client's individual capacity to make own informed choice. And lastly, in this era of U equals U and PrEP, labeling condomless sex as risky or unprotected is not only imprecise, but it is also stigmatizing and counterproductive. So I now would like to conclude by summarizing that the status-neutral approach to HIV emphasizes equally both treatment and prevention to end HIV epidemic. And as part of that challenge is that sexual health services are very much stigmatized as they are linked to sex and sexual pleasure, which are socially discrediting, especially in our region. However, healthcare providers must know now that withholding or distorting or selectively communicating U equals U and PrEP information violates medical ethics, perpetuates health inequity, and violates sexual rights. And lastly, we may need to simply recognize the do's and don'ts to ensure stigma-free and discrimination-free communications in healthcare setting, and finally in the public. Thank you very much for listening.